Rabies is a viral disease that affects the central nervous system and is almost always fatal once symptoms appear. While rabies can infect various mammals, dogs are responsible for the vast majority of rabies-related human deaths, particularly in regions where the disease is still prevalent. According to the World Health Organization, rabies-infected dogs account for tens of thousands of deaths annually, primarily in developing countries. How rabies spreads. Rabies is primarily transmitted through the bite of an infected animal, as the virus is present in the saliva of infected animals. When a rabid dog bites a human, the virus enters the bloodstream through the wound, leading to a series of events that can ultimately result in severe illness and death if left untreated. Pathophysiology of rabies. Once inside the body, the rabies virus travels along the nerves towards the brain, where it causes inflammation. This journey can take anywhere from a few weeks to several months, depending on various factors, including the location of the bite and the amount of virus introduced. The virus replicates in the muscle cells near the bite site before making its way to the central nervous system (CNS). Once the virus reaches the CNS, it spreads rapidly, leading to symptoms such as fever, headache, confusion, and anxiety. As the disease progresses, more severe symptoms can occur, including hallucinations, paralysis, and hydrophobia, fear of water, as the virus affects the brain and the nervous system. Ultimately, without prompt medical intervention, rabies leads to coma and death, often within a few days to weeks after the onset of symptoms. Why rabies-infected dogs are dangerous. The danger posed by rabies-infected dogs lies not only in the lethality of the disease, but also in the high prevalence of rabies in certain dog populations. In many areas, particularly in parts of Asia and Africa, stray dogs are common and may be unvaccinated, making them potential carriers of the virus. Additionally, rabid dogs can exhibit aggressive behavior, increasing the likelihood of bites. The disease is preventable through vaccination. However, in regions where public health infrastructure is lacking, vaccination rates for dogs remain low, leading to increased rabies transmission. Education on responsible pet ownership, including vaccination and managing stray dog populations, is essential to prevent rabies outbreaks. Prevention and treatment. Immediate treatment after a dog bite from a potentially rabid animal is crucial. Post-exposure prophylaxis (PEP), which includes a series of rabies vaccinations and sometimes rabies immunoglobulin, is highly effective. If administered promptly, this treatment can prevent the virus from reaching the CNS and causing the disease. Raising awareness about rabies. The importance of vaccinating pets and seeking medical attention after potential exposure can significantly reduce the incidence of rabies-related deaths. By educating communities about the risks and prevention methods, we can protect both humans and animals from this devastating disease. Understanding the dangers posed by rabies-infected dogs is essential for preventing transmission and saving lives. With prompt medical intervention and responsible pet ownership, we can combat this public health threat effectively.